So marijuana remains a Schedule One substances under the Controlled Substances Act of 1970, and according to that act, a Schedule One substance has a high potential for abuse and has no currently accepted medical use. In fact, it goes on to state that there is a lack of accepted safety for the use of the drug, even under medical supervision. And number two, absolutely, there's no relevance whatsoever to cannabis. There's plenty of medical use, that the NIH has funded, significant research on and found, societies like the American Cancer Society, for example, recommended for analgesia and for, addressing issues of nausea, during chemotherapy. So, clearly, by that light, it shouldn't be Schedule One. And also in terms of its high potential for abuse, remember, this is one that wasn't really even on the list for Henningfield and Benowitz. And it's not really in the same league at all as opioids, for example, or nicotine, in terms of its potential for the development of a use disorder. So it's still a Schedule One substance, which makes it much more difficult to conduct research, funded by the National Institute on Drug Abuse. And one of the other complicating factors here is how the federal source of marijuana for research purposes is still limited to only one growing facility, down at the University of Mississippi. Under the Obama administration, there was an attempt to loosen those federal restrictions on who could provide the marijuana for research purposes. But that has not moved forward at all, and it still remains in 2020 anyway, the only source. And what's remarkable is that this is a quote from Dr. Hutchinson, who does a lot of research at University of Colorado Boulder on the effects of cannabis. Was doing research basically on mood and cognition, etc. And Dr. Hutchinson, describes his research and the issues that he had utilizing this limited University of Mississippi source for marijuana in his studies. He the quote is, "We had them smoke it in the lab, then studied their mood and cognition. And what they told me was," these were subjects in his experiments, that was disgusting. What are you giving me? I would never ever smoke that stuff. So literally, the University of Mississippi freeze dries the the product. They keep it freeze dried for a year to up to 3 years, and then ship it out for research purposes. So that's not good. That's you can get it from so many different sources in states where it's legal. This is actually in some ways it seems almost like an effort to bias the research towards more negative results, because the quality of what they're using in these studies is so demonic.